Do you often feel pain in your joints or weakness in your bones? You're not alone. Millions of older adults around the world suffer from joint and bone problems every day. Today, we will talk about 3 of the most common conditions: arthritis, osteoarthritis, and osteoporosis. We'll explain what they are, why they happen, and how you can manage or even prevent them. Let's get started. Arthritis, inflammation of the joints. First, let's talk about arthritis. The word arthritis means inflammation of the joints. Imagine the cushion inside your joints becoming irritated and swollen. This makes the joints painful, stiff, and sometimes warm to the touch. There are over 100 types of arthritis, but the most common are rheumatoid arthritis and gout. Rheumatoid arthritis is when your immune system mistakenly attacks your joints. Gout happens when uric acid builds up in the body and forms sharp crystals in the joints, especially in the toes. The symptoms are usually joint pain, swelling, stiffness in the morning, and difficulty moving. How can you manage arthritis? Doctors recommend regular, gentle exercise, like walking or swimming, to keep joints flexible. A healthy diet, weight control, and medications prescribed by a doctor can also help reduce pain and inflammation. Osteoarthritis, wear and tear of joints. Next is osteoarthritis, also called wear and tear arthritis. This condition happens when the smooth cartilage that covers the ends of bones begins to break down. Without this protective layer, bones rub against each other, causing pain, stiffness, and reduced movement. Osteoarthritis usually affects the knees, hips, and spine. It is more common in older adults because our joints naturally wear out as we age. But being overweight, having previous injuries, or doing heavy physical work can increase the risk. Symptoms include joint pain that worsens after activity, stiffness after resting, and sometimes a cracking sound when moving the joint. To manage osteoarthritis, doctors recommend low-impact exercises like cycling or yoga, losing extra weight to reduce stress on the joints, physical therapy, pain relief medications, or in severe cases, joint replacement surgery. Osteoporosis, weak and fragile bones. Finally, let's talk about osteoporosis. The word means porous bones. It happens when bones lose their strength and become fragile. This condition is often called the silent disease because most people don't notice it until they break a bone, often in the hip, wrist, or spine. Osteoporosis is more common in women after menopause, but men can also get it. Risk factors include aging, lack of calcium and vitamin D, smoking, drinking too much alcohol, and not exercising enough. Although osteoporosis doesn't usually cause pain until a fracture happens, warning signs can include loss of height, stooped posture, or sudden back pain. The best way to fight osteoporosis is prevention. Eat calcium-rich foods like milk, cheese, and leafy greens. Get enough vitamin D from sunlight or supplements. Do weight-bearing exercises like walking or light strength training. Avoid smoking and limit alcohol. Arthritis, osteoarthritis, and osteoporosis are 3 major health issues that affect millions of older adults. They may sound similar, but they are very different. Arthritis is joint inflammation. Osteoarthritis is wear and tear of joints. Osteoporosis is weak, fragile bones. The good news is, with the right lifestyle choices, treatments, and early care, you can still live an active and healthy life. Remember, your bones and joints carry you through life, so take care of them every single day.